Welcome to a brand new edition of Skin Sense. I'm your host, Jeannine Mazurkiwecz, and today, your favorite part of Skin Sense, we have procedures coming up a little bit later in the program. Right now, I'm with Dr. Steve Schleicher, and we have a special guest with us today.
Right, I am very pleased to announce that Rebecca Geiger, who is a physician assistant, has just joined my practice.
Yay.
And Rebecca, maybe you can tell everybody about yourself. We're so pleased to have her. She has vast fund of knowledge, especially in the field of plastics and surgery. So, Rebecca, yeah, tell everybody.
Yes, I relocated here from the Pittsburgh area about a year ago. For the past 11 years, I was working in plastic and reconstructive surgery. So I have a lot of experience doing procedures with cosmetic experience with injectables, lasers, different things like that Dr. Schleicher does here in the office. So I'm very excited to increase my knowledge in dermatology and continue practicing medicine in this area of the state.
Yeah, and we're delighted to have her. As many of you know out there, I kind of needed help.
He needs help, all right. He needs a lot of help.
Besides the mental help, we need physical help, and we're getting kind of overwhelmed. So again, you know, we're really delighted to have Rebecca, and hopefully we'll have new additions as well.
All right. Well, today we are going to be doing two procedures. We're going to be doing one that I found to be very popular. I was really shocked when I asked for people to come on the show to get spider veins removed. It's very popular.
Yeah, leg veins are very distressing to a lot of people. Obviously, most of them are female patients. And as people get older, leg veins tend to become more pronounced. But some people have them younger, and a lot of it's hereditary. Some has to do with childbirth, you know, you give birth to kids, and you're obviously putting pressure on your veins. But again, if it's heredity, it's heredity. Doesn't matter if you have kids or not. And a lot of people find them disfiguring. The good thing is it's very easy, for the most part, to get rid of the superficial leg veins. And Rebecca's going to demonstrate. Maybe you can even talk about the procedure that you're going to do.
Yes. Absolutely. We're going to show that coming up. And the other procedure that is brand new, and the rep was actually here today during the taping, was microneedling. Right,
which is another hot procedure. And basically what we're using an instrument to actually penetrate the skin with tiny little microneedles. And we use that for scars, we use that for facial rejuvenation. And basically what that does is it actually helps stimulate the body's own collagen, okay, to correct, say, scars, and hopefully to help mitigate against wrinkles and perhaps even prevent wrinkles as well.
So again, you could stay right here in the Hazleton area and get these procedures done. You don't have to go to Philadelphia and outside of the area to get plastic surgery procedures done, correct? All right.
Unless you want to go to Miami, then you're welcome.
Well, there you go. Then you can go to Miami. Now, if you come into the office, and I'm here a lot, they have these new boards up. Talk about these boards. Is it a smart board?
Well, we just got it. Yeah, it's a smart board.
Doctor doesn't know how to work it yet, so.
Well, no, I figured it out. Thanks to help. But I mean, it's really cool.
So is this to basically show the patient?
Yeah, you could show people where in their skin the damage has occurred, what to expect from, say, certain treatments, and it goes through. There's all kinds of different, you know, venues here. We can talk about things like shingles, and we can go over what shingles means, what it's actually caused by. And so it's really wonderful. And your company gave it to us, and we're very pleased with it.
Have you been using it a lot in the office? Because it looks like
people play with it, especially kids. We have kids who don't want to leave the office.
They probably know how to use it better than us. It's like a big computer.
Yeah, definitely. But it's really, really a neat invention. And like, you know, you can go through anything. I mean, any specialty, head for, I guess, for like this. And the other cool thing is too, you can annotate. You can actually make diagrams, okay, and say if there's a lesion here, which is really cool. And I do things like telemedicine, where I actually work with prisons and indirectly, and they send me images. So when I get an image, I can actually circle it, you know, on the computer, and let's say we want to do a biopsy. I can tell them exactly where to do the biopsy. So it's really awesome.
Technology is awesome. All right, when we come back, we're going to have a procedure. We have a guest with us. We're going to look at those leg veins, and it's really cool. Stay with us. You're watching Skin Sense, seen on SSP TV and SSPTV.com. And we're back here on Skin Sense, seen on SSP TV, and we are going to show you several procedures today. We have my sister-in-law with me, Lori Lasant, and we have Rebecca Geiger. She is a physician's assistant here, right, at Dr. Stephen Schleicher's office. So today we're going to be talking about spider veins, right? Okay.
Yeah. Which is a very common problem. Lori has a couple that will respond very well to the procedure that we're going to do. We're going to do some sclerotherapy for her today. The product that we're using is called Asclera. What it does is it causes an inflammation in the vessels. And the reason that you have spider veins is because they're not working properly anyhow. So the blood kind of settles in there. So you see the blues, the purples, sometimes even the reds on the smaller ones. What this does is it causes an inflammation in the vessels, and then it kind of closes down on itself so that those vessels go away.
All right. I was really shocked to see how many people responded. I did a Facebook question on my Facebook page saying, you know, we're looking for people to come in and have this procedure done. And a lot of people have these leg veins. What specifically are you looking for this procedure? Who is a good candidate for this?
Patients who are a good candidate for this, these are for your spider veins. So these are for your little tiny blue, red, purple veins. This isn't for your varicosities, like the big, the ones that almost look like worms.
Yeah, the juicy ones.
Yes, exactly. This isn't for the big varicosities. These are for your little veins. So if you can push on them and they go away, that's kind of a good sign that they'll respond. If it's anything like bigger, it's not going to respond just because they're so large. This is for your little tiny veins.
All right. Do you have any questions before we begin?
No, I don't think so. I'm ready.
You're ready? I have a ton of questions. I'm not even getting this done. I guess that's my job though, right? All right, so we're going to turn Lori over and we're going to talk about the procedure.
Okay.
All right, well now the patient is in place and we're set to begin this procedure, which is relatively quick.
Yeah. So what I'll do is after you get the patient in position, I'll clean the skin off with an alcohol pad just in the area that I'm going to be working. So she has a pretty good size vessel here on the back of her leg. So I'm just going to clean this off with an alcohol pad before I get started. Okay. And then what we'll do is we'll go ahead and get started with injections. Now, unfortunately for her, the back of the knee is a little bit more sensitive than other areas. Okay. It's a little bit tender, but honestly, whenever you have the injections done, as far as discomfort, you might feel a little tiny pinch when the needle goes in. And sometimes people say that the solution burns a little bit. Okay. But most people don't even notice it. Okay.
Now, will these disappear in a couple days for good, or will you need?
It takes a little while.
Okay.
Yeah. So initially, when we do this injection, if you can try and get a close-up of this, you'll see that it'll kind of blanch itself out. Okay. So
Are you ready?
Go ahead and do this pinch. Okay. All right. So you're gonna feel a little tiny pinch here. Let me just make sure I'm in the.
You okay?
Yep.
All right. And if you can see that, how it kind of just goes along the vessel itself, okay? So that took care of a good portion down here. Just gonna grab a little.
That's neat.
Okay, and then so you can see it even goes up into here a little bit. So what I'm gonna do is I'm gonna go up here now. So a little pinch, and then you can see how it kind of spreads out in that portion.
So what exactly is that doing?
So
Are you okay?
look, now if you watch, it kind of travels up.
Right.
You can see that go up even further. So what I'm going to do is I'm going to go over here to this side because we haven't seen anything over here yet. There we go.
That is so neat.
All right. So you do get a little, you can see that little bump there at the injection site. That'll go away. They're like little bug bites after the fact. All right, we're going to go to the top here again. So that one went into a deeper one, so we didn't notice as big of an effect, but you did see a little bit of a difference there.
Now, will she have to? What does she do after?
As far as
she gets
downtime and recovery, what I'm going to do today is I'll put a little wrap on her leg. I would prefer that she keep that on for about 24 hours, okay? And then after that, she can take it off, she can shower, and then compression hose for at least, it depends, 7 to 10 days afterwards. I usually tell people anything below the knee, so a knee-high compression hose of any type, 7 to 10 days afterwards. As far as exercise, they can do whatever they want. They can be out in the sun. There's no restrictions.
All right.
Okay. And like I said, as far as discomfort, you feel the little pinches when you're having it. Afterwards, nothing. Now, afterwards, so I don't know if you can see this with the camera, but you can see that the vessel kind of almost gets a little bit of swelling too. That's completely normal, and that's what's supposed to happen because it's causing irritation inside of
Got
there.
ya.
Yeah. So we treated this whole area here.
Oh, so that's all done?
Yeah.
The whole area? Okay.
Yeah. Yeah. I mean, if she had more, I would have to do more injections, but that treated that whole area there.
Okay.
Okay.
How you feeling?
Great.
All right. Well, we'll finish up with the other side, and then we'll get some interviews with Lori.
Okay. Great.
All right. So now after you do the injections, this is what the patient could expect
As far as afterwards, yeah. So I'm just gonna she's holding a little bit of gauze there for me. I'm making her work for it.
All right.
And then what I'm gonna do is just put a little bit of compression here. Okay?
Why is this?
It's nothing major. Well, mainly for bruising.
Okay.
And then it helps too if they get a little bit of swelling afterwards. Okay? So it just puts a little bit of pressure there. And then that way, it's not like a cumbersome wrap or anything like that. It's just a little bit of local compression. And then after 24 hours, she can take this off, she can get a shower, and then she can put her own compression hose on. Okay, so, and I am going to put a little dressing over this too. These are very superficial, so I don't need a lot of compression on this, but I'll put a little compression over that too. The main area that I did, and I put the most medicine right here though. Okay.
Okay,
Question?
so then after I take this off, I put the compression hose on. Does it matter what kind of compression I buy?
No, honestly, it doesn't. We're getting into the warmer months. So one of the things that you can get knee high, you can get thigh high. Studies have shown there's not really any difference between knee high and thigh high compression. So it's more comfortable for you as a patient to get the knee high. One thing that I have patients do during the summer, they have the compression running socks. So it's just like between your knee and your ankle. So you don't have to worry about pulling that on and sweating during the summer. So the compression running socks I really like, and you can get those online anywhere.
Okay, great.
So you can actually get this procedure done anytime. I was thinking the best time would be for winter, but spring and summer is okay.
Yeah, I mean, right now is kind of a good time to do it because you're getting ready, gearing up for the summer. So yeah, this is a time that we would more typically do it, but people do it during the summer too. It's easier to do it during the winter whenever you don't have a tan because you can see the vessels better. But if you have a tan on your legs too, you can also do it during the summer.
Great. So if anyone wants information, they can call the office, and you could get the procedure done and be out and about in your bathing suit by the evening. Welcome back. If you're just tuning in, you're watching Skin Sense here on SSP TV and SSPTV.com. We just got done seeing a procedure for leg veins, right?
Right, correct.
And that was an easy procedure. I really thought that there would be more pain involved with it and there would be more downtime as far as exercise. But as you said, she'll be able to walk tomorrow and do her regular routine.
That's one of the nice things about sclerotherapy is there's no downtime, there's no recovery, there's nothing that you have to do to prep for the procedure itself. Another thing that I didn't mention is as far as treatments that are required. It really is individualized depending on the patient, how difficult their veins are to treat, how well their veins respond. Some patients, they do one treatment, respond very well, don't need another treatment. Other patients, they need several treatments. And that's the thing with leg veins. They're kind of a pain in the butt because they can be resistant to treatment. So usually what I recommend is let them heal for about 4 to 6 weeks. If they look good, that's great. If you still have some remnants there, you might need a full, second treatment, or you might just need a touch-up. It kind of is really dependent on you and how you respond to the treatment.
There were two other questions I actually forgot to ask you about that. Could someone be allergic to the injection, and will the leg veins come back?
For the second part first, the leg veins themselves, you're going to have leg veins. If you have leg veins to begin with, it's usually a hereditary problem. Okay. So the ones that we treat will not come back, but you can always have other ones in different areas that might pop up.
Got ya.
As far as the product itself, I mean, they've done tons of trials and studies to make sure that this product is very non-reactive, so it's very unlikely, that you would have any type of reaction to it. Like I said, you saw when we did the injections here, you get those little bumps right at the injection sites. It's like a little bit of inflammation. That's about all you'll see.
Okay. All right, on to our next procedure, because this is brand new. We were here when the rep came in to talk about it. It's called microneedling.
Right, which is the hottest procedure. And basically what we're doing is we're using tiny little needles to penetrate the skin. And basically you're going down and actually you're having some bleeding, okay, which is in this case a very good thing. because what we want to do is stimulate the collagen below the skin to regenerate. And by doing so, we're helping to correct scars, helping to correct wrinkles, but possibly even to prevent wrinkles as well.
All right. Well, let's look at this is the piece of equipment right here.
Yeah, so the handpiece is small. It's just a small handpiece, and it has a cartridge that goes in it. The cartridge itself has the small, tiny micro needles. When you turn it on, what it does is the needles actually go in and out, and they make tiny little impressions into the skin. So that makes it different from doing any type of laser resurfacing. Laser resurfacing is a thermal injury to the skin, where this is actually a mechanical injury to the skin. So there's less downtime, less recovery with the procedure itself. So like you were saying, you can get a little bit of bruising with it, and you can get a little bit of redness and bleeding. But the bleeding in this case is a good thing, because you want to see that, because that means you're going down into the dermis of the skin and going to get that result that you're looking for.
So who's a good candidate to get the micro needling done?
Patients with acne scarring, even regular scars. You can treat cesarean scars, C-section scars, any type of scar in itself. Fine lines and wrinkles.
Yeah, and a lot of people love microdermabrasions, okay, and they're very, very popular. This is really a step above that, okay? So microdermabrasion is superficial sanding. With this, we're actually going below the surface, okay? So it's the next step. And you could do the same thing with certain lasers, which the treatments are extremely expensive, okay? This procedure is not very expensive at all. Usually a procedure costs around $150, $175 for the procedure, as opposed to some lasers which may cost $600, $700. And we've seen equivalent results, okay? And a lot of other dermatologists and plastic surgeons are reporting equivalent results to very, very expensive laser treatments.
So this isn't covered under insurance, even
No,
in
these are all
scarring?
cosmetic.
Okay, this is cosmetic.
Same with the leg veins too, are basically cosmetic procedures. But the good thing is they're not very expensive procedures.
Okay.
So,
And is this a one-time treatment, or will you need a different?
microdermabrasion, or rather microneedling or microdermabrasions, you like to repeat them. And you can repeat them as early as 2 weeks or as late as 4 weeks. And you may do a series of, say, 3, 4 to get maximum result. You don't have to, but you really want to do whatever you can to build up the collagen as best you can.
So does it
So it's
depend on your
better-
skin type?
Not so much your skin type, but some people have very coarse features, okay? Some people have scarring that's fairly deep. And in that case, yeah, you would need more treatment.
Okay, so someone who's a candidate for this, they would come in first and you would
Right, we would
look at their scar?
evaluate them and we'd go over the whole procedure. And one thing to mention too, I mean, this is a little bit invasive. These tips are totally sterile, okay? So when we're done, we just dispose of the tips and we get a new one, okay? And that's how they're packaged. Tip fits on here. So it's individualized for each patient.
So the patient comes in, they get the procedure done as we're seeing, and then you can see that there is bruising. So this isn't something where you can leave here and actually go out to an
Well, it's not
event.
so
You need
much
some
bruising.
time.
I mean, it's really pinpoint little bleeding. Okay, and a day later, patients can wear makeup.
Okay.
So it's not an invasive procedure. I mean, you can do certain lasers or certain dermabrasions where you're actually peeling away layers of skin, which can take 10, 14, sometimes 3 weeks to heal. No, this is much less invasive than that.
How long does the procedure take?
The procedure itself kind of depends on what area of the body or what area of the face that we're treating. I would say anywhere from 15 to 25 minutes, depending on what we're doing. When you come in for the procedure, as long as you're an approved candidate for it, what we do is we put some numbing cream on. What the numbing cream does is it kind of helps to dull the response to the procedure. Does the procedure itself hurt a lot? Not really. I mean, patients, you know, they say it kind of feels like a rubber band stinging them. It really depends on your pain tolerance. But when you do come in, we always put a layer of the numbing cream on. We let that sit for about 15 minutes. We take that off, cleanse the skin, and then we do the procedure. So like I said, probably like 15 to 25 minutes, depending on if we're doing a full face or just a small scar. You know, it kind of depends.
So this is a better procedure to have done for scarring than the microdermabrasion.
Right. Microdermabrasion removes like superficial cells from the epidermis. Okay. So it's a very superficial treatment. This is more therapeutic. Okay, because you're actually going beneath the surface. So it's a whole different procedure from that standpoint.
Is there a certain time of year that this would be better to get? Because I know with microdermabrasion, you get that more done in the winter months.
Well, the thing is, with any procedure where you're penetrating the skin, you have to be careful with the sun. So if you get one of these procedures, then we tell our patients to wear sunscreens, okay, which people should do anyway, especially if you're fair skinned. But especially if you have a procedure like this, yeah, you always want to wear sunscreen, certainly directly after the procedure. And it's a good idea to just keep using them because sun promotes darkness and you know, those blotchy areas of the skin, it promotes wrinkling. So nobody really wants that. So, you know, I mean, people like to look tan, but the long-term, you know, basis for skin damage is sun actually destroying collagen, okay, and promoting skin cancers. So you don't want that to happen.
Very good. In closing, final words.
It was a fun procedure, right?
Yeah,
Rebecca
absolutely.
really enjoys doing the procedure. So.
Absolutely. I mean, it's a great alternative. Like he had mentioned with the lasers themselves, this is minimal downtime recovery. I mean, you could have this done and go back to work the next day because you really are just going to look like you're flushed. Whereas with laser resurfacing, you have a downtime of minimum of 5 days, you know, depending on how deep they go with the laser. So this is great for, you know, that all over resurfacing, kind of freshen things up. You know, especially around the mouth, people are always asking, you know, the fine lines and wrinkles around the mouth. This is a great procedure for that.
Okay, and specifically, what are you good with? What procedures have you done the most? Aside from these, what do you?
Besides these, I have experience with all injectables, so Juvederm, Radiesse, Belotero, Voluma, Botox, and then laser treatments. I've done laser hair removal, laser resurfacing, leg veins with the laser, and doing the injections with the leg veins. We don't do the PRP here, but I do have experience with PRP as well.
Well, it's good to have you here. Sometimes I know my friends or some questions I get, they are asking me questions about procedures and I'm going to direct them right to you. But it's nice to have a woman here in the office, to have a woman's touch with you, Doc.
I could always wear a dress.
All right, well, thanks for joining us. Again, if you have any questions, you can call the office. You can certainly ask me questions, and we'll have more procedures here on Skin Sense. You can watch us on anytime at ssptv.com. We'll see you next time.